I would love to tell you more about Shannon, but rather than steal my thunder, I'll let her go ahead and introduce herself, because she'll probably do a much better job of it than I will. But thank you very much for coming. And Phil was just commenting a little while ago that sometimes we get a little bit inbred with this brown bag luncheon. You know, it's good to have some outside people come in, and so we're really pleased to hear what you can. Some information that you bring to us. Thank you.
Thank you. I appreciate that. So I'm so thrilled to be here today. I traveled over to Australia about 2.5 weeks ago to speak at the World Congress on Positive Ecology in Melbourne. And when I was first planning the trip, I reached out to Professor Craven and let her know what a big fan I've been of the work being done by so many folks in this room and in the Institute for quite some time now, and said while I'm in the near vicinity, I was thinking of planning a trip to Sydney. Would it be okay if I stopped by? And she suggested speaking at one of these brown bags. So it's been several months since we've liaised about that, but I appreciate the opportunity to present my work. And what I want to talk about today is some of the research that I've been doing in the field of school psychology in the States, and how that's kind of been along the lines of the work that's been done in parallel to the CLEAPS initiative going on over here in Australia. So the research that I'm going to share today has been going on for about 20 years now in collaboration with my mentors at the University of South Carolina, where I was fortunate to work with Scott Huebner and develop some of the early scales of student life satisfaction. And when I left the University of South Carolina, I moved to Tampa, Florida, where I've been for the last 15 years, and been collaborating with various educational researchers and measurement developers and school psychologists to apply the work coming out in positive ecology to our school-based practice. So I want to acknowledge my collaborators, who are many graduate students, past and current, as well as faculty collaborators. All of my work is done in Florida schools, so very indebted to the Florida schools for participating in this research. And then also recently have been gifted with funding from the Institute of Educational Sciences to research wellness among high school students who are in accelerated courses. I wanted to thank those sponsors too. So the work that I've been doing in Florida schools in the last 15 years has been informed by some of the larger contributions to the field by lots of folks, listed a few just up here, that I've been trying to stay abreast of what works to increase adults' happiness and apply those strategies to adolescents, and then make developmentally appropriate modifications for younger and younger youth, and then also take those same strategies and see what works best for teachers and administrators' well-being too. So very grateful for the folks who have been doing this work for quite some time. So I have some background to stand on. And what I've been doing in Florida in particular, so here is, if you're not familiar with Florida, I'm in Tampa, which is on the west coast of Florida. And what I've been doing for quite some time there is a series of studies to first see what correlates with youth life satisfaction using some of the measures that Scott Huebner and I developed in South Carolina. And then trying to empirically see, is there a reason to attend to youth subjective well-being above and beyond attending to mental health problems. My job at the University of South Florida is to train school psychologists. So my students graduate and go work in the schools. They serve 1 to 2 public schools and provide the range of assessment and enrichment services. And historically, most of our work has been on identifying and treating mental health problems. So one of the first things I wanted to do with my research was see, is there a reason to attend to mental health beyond the absence of problems? And if so, how does that link to educational outcomes? So I'll share a bit of that today. And then also share with you the work I've been doing recently to develop interventions to increase students' subjective well-being, both for kids that have room for growth and more school-wide. And happy to take questions at any point, so please interrupt me if you would like anything clarified or just want to know anything further. So first, I'll share with you some of the research I've been doing on what I refer to as a dual-factor model of mental health. So when I first started looking at life satisfaction in youth, I often got the question, is this the opposite of kids who have mental health problems? So if So we find kids that have mental health problems, internalizing, externalizing issues, anxiety, depression, and conduct problems. Are those the same kids that are unhappy? Like, is there a reason to even look at happiness? Or is it the same continuum of mental health problems? So some of my earlier work was we screened large samples of elementary, middle, and high school students using two different constructs of ways of examining mental health. We looked at a traditional way of assessing youth mental health as the presence of clinical levels of emotional problems like anxiety, depression, as well as conduct problems. And traditionally, if a student had a T-score of 60 or above on our standardized assessments of mental health problems, those are the kids that we target for mental health services. So we wanted to see, were there kids who perhaps didn't have elevated levels of problems, so we would miss them on our screeners of mental illness, but when you ask them about their life satisfaction and look at their positive and negative affect ratios, had low subjective well-being, even with the absence of mental health problems. And if so, there would be a need to attend to mental health beyond mental health problems. Also, are there kids that might come up on our symptoms of our screeners of symptoms, but when you get in there, say, life's going okay for me, either I'm anxious, but I can manage this, or maybe I'm causing other people problems, but not myself, so have high subjective well-being, and that group we term symptomatic but content. Some of my first work wanted to see if these two groups exist, as well as establishing what percent of youth at a given time have high levels of problems and low happiness, or low levels of problems and high well-being, to kids that we would refer to as having complete mental health. So if these two groups existed, there was an empirical rationale for operationalizing youth mental health beyond mental illness. So what we found through surveying public school children across elementary, middle, and high schools were, yes, those two unique groups exist. So it wasn't a one-to-one correspondence where if you had high well-being, then you absolutely had low mental health problems. Instead, we found a sizable group of students that were vulnerable. They didn't have either teacher-rated externalizing problems or youth-rated internalizing problems, but when asked our life satisfaction, emotional well-being, were relatively low on our levels of subjective well-being. So those are kids that we refer to as vulnerable. We also found a sizable number of kids who were referred to as symptomatic but content did come up as in the at-risk range on mental health problems, but also had high well-being, which is different than you expect with the assumption that mental illness is all there is to it. About 14% of Florida youth at any given time are referred to as troubled. They have a combination of clinical levels of mental health problems and also low well-being. And fortunately, any given time across our elementary and middle school samples, we see that about 60% of kids have a complete mental health profile. So some early data to support the fact that well-being and problems were not the same thing. Instead, it was possible to have low problems, but also low well-being.
How did you define high and low well-being and mental health?
Great question. So we started by, this is the easier one to define because we used standardized no reference measures of mental illness. So we used the Achenbach measure of, referred to this child behavior checklist that was standardized on thousands of American youth. And we used a cut score of T, one observation above the mean, the T is 60, which is a traditional cut score in school-based screenings. So there are no norms for SWB, for well-being, if you will. So what we did to establish high and low levels there, we actually did two things. The first way of looking at it was trying to make clinically meaningful cut points. Whereas like life satisfactions on a scale of 1 to 6, we have dissatisfied ranges and positive satisfaction ranges. We first start looking at a cut point of if you're in the dissatisfied range, and that would be low well-being. But what we saw is that if you didn't make the cut points to be the exact same, then you might artificially put kids in these two groups just by having different cut points. So once we found out what percent of our sample had elevated levels of internalizing or externalizing distress, then we've made our SWB cut point be the exact same percentile so that we didn't artificially create these extra groups just by our cut point. So the cut point tends to be about 25% or so. Usually about 75% of our kids have, about 25% of kids have clinically elevated mental problems. So then we'll make our cut point for SWB be also 25%.
Right.
So the lowest quarter would be low well-being. And if we did it that way, then we, if there was only a one continuum factor, like one continuum of mental health, then mathematically every kid that had mental health problems could have low wellness, right? So that's the cut point. It corresponds to the level of mental illness in a given sample. Great question. Other questions? Yes?
I mean, one of the issues there is the cut points are pretty crude. So you're taking a continuum.
Yep.
And I understand why it's reasonable in terms of the typology for doing that, but there's clearly better ways of using that data.
Yeah, that's a great question, a great point. And what we've been doing the last few years is latent profile analysis and some other ways of looking to see how many groups emerge. When we do it that way, we still see 4 groups, but we've gone back to the cruder way, to be frank, because the interpretation by school psychologists with that actual cut score is a little easier than a mathematical way that's more accepted in like research communities.
It makes sense that you get 12 profiles from a profile analysis too, just because you have 2 variables. So there's, high in both, low in both. It's just mathematically the way it would come out.
Yep, yep. Great point. And I'm really open to other ways of looking at those groups because it's a really important conceptual approach to make sure we're doing well. So what we did after we looked to see if there were different groups were, do the groups differ on educational outcomes? Because are there different groups? Like, that's interesting to me as somebody who wants to know about well-being in different ways, but do kids who are high or low on different levels of mental health differ on educational outcomes and outcomes in other life domains that are salient to adolescent development? So educational outcomes, we looked to see if there were differences between kids who neither group had clinically elevated levels of mental health problems using our Northern's tests, but had higher well-being scores than kids who had lower well-being scores. Then we also looked to see were there differences between groups of kids that both had mental health problems, but one had elevated well-being and one had lower well-being. So what we found in grades is that yes, even after you control for SE, socioeconomic status, and prior achievement and family educational status, that the students that had complete mental health had better achievement that school year than students who still had no mental health problems but low SWB scores. We also found some differences on our end-of-year academic assessments. So in Florida, we used to use a test called the FCAT that was our state Norm Reference test of academic skills. And it was on a scale of 1 to 5, and higher scores, 5 was the highest score possible. And what we found were that at the end of the school year, the students who had complete mental health, that mental health profile, had higher levels of reading and math skills than their peers who also had no mental health problems, but had lower life satisfaction and more negative affect.
Does the mental health include externalizing?
Yes. So for a student to have mental health problems in our study, they had to have a score of 60 or higher to score in an elevated range on either youth-rated internalizing or teacher-rated externalizing.
An interesting way of looking at how much you lose by taking the crude dichotomies would be to take your outcome variables and predict them with the raw scores on your mental health and your subjective well-being. And I would guess that you're probably losing 20% of the predicted variance by using those cut scores. And
probably less. I assume that you use this to make decisions, right? So a kid that gets a score of above 60, that triggers some sort of response from the school or something like that. Are you looking at a way of using the subjective well-being as a trigger as well? Yeah, okay, so that makes sense.
I'll share that. Share that next.
yeah, and I understand that there's a balance, and you already said that you have to be able to describe to the practitioners what it is that you're doing.
Yeah. but it's a great idea for reanalyzing data and for a different purpose. So we also looked to see if there were differences on classroom engagement, and we found where there was advantages of having a complete mental health profile over the vulnerable profile on behavioral engagement, emotional engagement, different indicators of cognitive engagement. And we looked at attendance and saw the students who missed the most school were the students who had the combination of low life satisfaction and high negative affect, along with no mental health problems, that vulnerable group. And we also looked at social outcomes and saw, whereas earlier, these two groups of kids that had elevated externalizing or internalizing scores, but different levels of well-being, there really wasn't a protective nature of SWB, if you will, on our academic outcomes. Instead, in our sample, if you had mental health problems, the level of happiness you had wasn't predicting much above and beyond the fact that mental health problems were getting in the way of academic success, if you will. But once we turned to social outcomes and identity development, what we saw were these students that had clinically elevated levels of mental health problems, but also high well-being, had more intact social relationships with their classmates and teachers. At a high school sample, even with their romantic satisfaction, we asked them about their dating history. And then also experienced less peer victimization than the students that had a troubled profile. So we saw some interesting effects with that symptomatic but content group in any outcome besides academics. So even in physical health, the students that were symptomatic but content had better overall self-rating physical health than their peers who had a troubled mental health profile. The students that were missing the most family activities due to physical illness were the students that had the combination of mental health problems and low well-being, which again is important when we look at how do we allocate our resources in schools. Are all kids that have mental health problems equally at risk for experiencing poor outcomes? What we were seeing was the students that were most, who had the worst outcomes, had this combination of poor mental health that was identified by the presence of psychopathology, but also low social well-being. And on the flip side, we wanted to have the best outcomes, the students who were doing really well. It wasn't good enough to just not have mental health profile problems. Instead, the presence of SWB was associated with the best outcomes. So we saw across different outcomes was the students that had a complete mental health profile that were identified as having no elevated levels of internalizing or externalizing problems, but also high SWB, were the kids who experienced better adjustment academically, socially, and to the physical health compared to their vulnerable peers. And we look at, again, who gets served in schools. If you don't have elevated levels of clinical problems, and where I work, then you're off the radar. And our data was showing that it might be more important to look, not more important, but equally important, if you will, to screen for life satisfaction too when we make decisions. Other questions or thoughts? I see the wheels turning.
We're waiting to ask questions later. I mean, I use cut points in a different context too, so I'm not against them, but I was just wondering if there was a way to, because if the goal is to identify students that need help with limited resources, is there a way to do that with a more continuous model?
Absolutely.
I was just starting to think that.
Yeah, absolutely.
Talk about that, yes.
Yeah. Well, when I first shared this data with some of our educational leaders in Florida, 2007-ish, it's been about 12 years, they asked the appropriate next step question of okay, so then how do we catch the kids who might be in this vulnerable profile? What measures do we use? What cut points do we use? And more importantly, what do we do with them? And that was in the kind of really early ages of positive ecology interventions, what's out there to increase to well-being. So I was really fortunate to have school leaders that worked with me to, getting ahead of myself a little bit, but worked with me to design interventions for kids that had low well-being. And one of the things we did early on was try to operationalize how do we define low well-being. And the measure we've used a lot, is the brief multidimensional students' life satisfaction scale. It's one of Scott Huebner's life satisfaction scales. that we developed for statewide use in South Carolina some years ago. And it's a simple paper and pencil measure, but we used cut points that were clinically meaningful, so kids who were in the dissatisfied range, but also at the school level reflected which kids were at relatively low satisfaction in that context. Some schools had more kids that would have come up high than other schools. But getting ahead of myself, what we've been using this data for I would say more systematic purposes is thinking through how do we define youth mental health. So we have quite the history of defining youth mental health in terms of internalizing or externalizing problems. And what we've been doing with the data from other model studies is layering in defining youth mental health also by looking at life satisfaction and happiness. Don't have all of the answers with how to integrate it best. I feel like we're still in that area. But even including this as part of the indicators of what makes us, what's important for determining a student to have intact mental health or in need of additional supports. So we've incorporated that into, I just give one example of some of our statewide work as part of Now is the Time Project Aware grant that Florida was granted. One of our first pieces of, one of our first tasks was to figure out if we have funds to improve the infrastructure for youth mental health in our state, how do we define youth mental health? Do we focus on just internalizing problems or externalizing problems or life satisfaction or social wellness? And we developed a comprehensive model of youth mental health that I'm quite proud of contributing to. The website you could pull it from if you'd like to. But we give this to our educational stakeholders in our state as a way of communicating what do we mean when we talk about students' mental health. We talk about their current levels of mental health problems, but also levels of well-being. If we define youth mental health in that comprehensive manner, then that has implications for what are the services that count, if you will, as a mental health service. So traditionally, those services that are geared towards identifying kids that have clinically elevated levels of problems are still important, but also important are services that are intended to improve well-being for all students. That's our Tier 1 services. And our schools in the U.S. are increasingly talking about a multi-tiered system of supports for students' mental health, where the first tier are these universal supports that promote wellness among all students. At the second tier are our early intervention supports for kids who have early symptoms. And then we reserve our most intense supports for kids that have severe problems. So when I shared this research with school leaders over a decade ago, the question was, well, what do we do for kids that have low life satisfaction, and what can we do to improve all students' mental health? And that was really in the early days of not yet having much to offer. So with the support of my local schools, we developed a Tier 2 support for students that screened low on the life satisfaction measure. And it's described, I was asked by Guilford to put together some information for practitioners, for psychologists and school counselors on how to promote student happiness. So it's a review of the literature, but also includes the intervention manual that we've been testing and refining over the years. And I'll leave a copy. I have a copy with me. I'll be happy to leave that here. Actually, I can share it with you now. I'm excited to not bring it back to Florida. So,
Thanks very much.
just lost a pound of luggage. It's great. I was over 3 pounds, so that's good. All right. So what the WellBeing Program consists of, that I've been developing and testing over the last decade, is a series of small group counseling meetings, if you will, to put it in the traditional language, where we have taken the positive ecology interventions that work with adults and made them developmentally appropriate for middle high school students, for teenagers. And then when we saw that the gains students made weren't always generalized or maintained over a 6-month period, we've incorporated ways of enhancing generalization by including parents. So what the students go through is a series of 10 sessions that follows closely Martin Seligman's original authentic happiness theory, that having positive emotions about your past, present, and future was one of the ways of creating sustainable happiness. So we go through activities that come right from the literature on evidence-based strategies for increasing adults' happiness, and then work with youth to go through the same type of activities. But then we've also included parents in a way that we have seen enhances generalization of the skills that students learn in a small group counseling capacity when led by a school psychologist or a school counselor. So what the parents learn when they first come in is like why happiness matters. And we share with them a bit of the rationale that the students that have the best outcomes have that combination of not just no mental health problems, but also the presence of positive emotions. And then as the students learn in a small group capacity activities to boost their own happiness, parents receive some information either via email or a hard copy flyer that summarizes what did the kid learn this week and what are some activities they can do at home to generalize that information. So for instance, here's what one looks like. The week that we go through gratitude journaling in this session, the parents get a one-page flyer that summarizes what the child focused on that week in the small group counseling meeting, and then what is the child being asked to do for homework to practice that activity, and then a few brief suggestions for what the parent can do to incorporate this activity in their own life at home. So in our last randomized controlled trial, this is the middle school level, to get into the weeds a bit with how we are the use of cut points, what we did was screen all 6th and 7th graders at this school, which I think there were about, I can pull the study, but it was about 600 students that we screened for life satisfaction using the brief multidimensional student satisfaction scale, and then students that had room for growth. So, which is a lot of room, because it's a tier 2 intervention. So on a scale of 1 to 6, basically anybody whose mean score of life satisfaction was a 1 to 5. So they weren't topped out, they had room for growth. And with room for growth and life satisfaction, we invited to take part in this small group well-being promotion program. And we have to have active parent consent for targeted mental health services. So we ended up with a sample of about 50 students that we randomly assigned to intervention or delayed intervention control. I think we ended up with about 120 that had the room for growth. And then we usually get parent consent for about 50% of kids to take part in the program, which is still one of our barriers, I feel, at Tier 2 supports, is destigmatizing any type of mental health support that's offered through schools. So what we had is our 10-week intervention. So the -10 is at baseline, and then post-intervention, then we had 2 follow-up points for a few months. And we matched the students at baseline on the students' life satisfaction scale and life satisfaction. So they're equal for a reason. It's a stratified random assignment. And we found that at post-intervention, the students that were in the intervention group grew in life satisfaction. It was a large effect, and then by 2 months later, the gap had narrowed but stayed at a medium effect. Where we saw larger gains was actually on positive affect. So they are matched on life satisfaction. So their baseline levels are a little different for the other outcomes. We didn't match them on every outcome. But for positive affect, we saw a large increase from baseline to post-intervention and a gap that stayed large through our 2-month follow-up period. For negative affect, we saw significant reductions in negative affect among the students who went through the WellBeing Promotion Program. And even though we weren't also treating comorbid mental health problems, what we saw was a small to moderate effect in the right direction on decreasing symptoms of internalizing and externalizing problems amongst the students that were in the intervention group. So we felt good. It's the second RCT. This one is the most recent one. We felt good about the intervention having a positive impact on life satisfaction and positive affect. So what we've been doing more recently is taking that intervention and implementing it in our local elementary and middle schools, and partnering with college students to be trained to be the interventionists to increase the capacity for schools to serve students who have this room for growth for happiness. So my graduate students and I just published this last year, our description of forming partnerships between universities and local schools to offer an undergraduate course in positive ecology in the schools, where the students it's actually a service learning class where the students learn the intervention as part of the course and then work in the local schools to support the students that are screened to have room for growth and life satisfaction. And so this is just a timeline showing it's actually possible to do all of that in this semester, the same semester that runs the university semester. Questions? I think I ran through that fast. Questions on the WellBeing Promotion Program or that Tier 2 support?
Just out of curiosity's sake, how did you manage the control groups? How did you, you took everybody that qualified and got to print, and then half of them
it was a delayed intervention.
Pardon?
So it was a delayed treatment control group.
So a waitlist control group?
Yes, and that's why we only had 2-month follow-up, because then we turned around and supported those students. So, and actually the students that were in the delayed condition, we actually ended up kind of double timing, if you will. The intervention was provided twice in a week, so we can get through 10 weeks and 5 weeks. And we saw like pretty sizable effects with the twice-a-week modality versus a once-a-week. But we provided it in that modality mostly for logistical reasons. Like the end of the school year was approaching, we wanted to support these children. But we were really pleased with something that we hadn't anticipated, which was like the better uptake and notice of information. We met the kids twice a week as opposed to once a week. So,
would you have had any diffusion effects, or from
right.
These were kids in the same schools?
Right, great question. We found they were in the same schools, the same classes. So they're randomly assigned to immediate or delayed intervention based on random assignment, not based on who are your friends, are you going to talk to other kids. But we found that we asked the students at the end and then each follow-up period, to what extent did you talk with other people about what you learned here? And they were talking to their parents, about half of them were, because our parents were also involved. They didn't report much discussion of what happened in the group with their peers. And then when we talked to the peers at the beginning of their wait list provision of services, we asked them their knowledge of the content, and their own self-reports were they hadn't heard about it through the grapevine, they hadn't learned much from their peers. But that's all they have.
The diffusion effect would work against you. So
that's a good point.
And I mean, we did one study with Ron and I did a study where we had control schools in addition, and we're able to. Now the intervention there was much more classroom based, so it's not surprising. But nevertheless, we were able to show that the diffusion effect was roughly half of the intervention effect. So
that's sizable. Wow.
Yeah, and so we got significant intervention effects for the diffusion group relative to the controlled schools.
That's fascinating. Now, I'd be curious, you can share with me later how you guys measured that. I'd love to hear better. We just asked the children when they first started with us, how much have you learned about this? And they didn't share much.
No, the intervention that we used was much less individualized than what you're talking about. So I would expect that what we were looking at, there would be greater diffusion effects, but it was really quite interesting to show that they were that big. Yeah.
I feel like we've had to work hard to get our middle school students to talk to anybody besides us and our small group about what they're learning. Like, we would like them to generalize it more. And so they've been pretty closed-lipped outside of our small group sessions. So when we got the parents involved, that actually was really helpful. When we started with the parents and said, we'd like you to be one other adult, asking them what they learned in this group, how is these different activities making them feel, and then giving those like weekly reminders has been our strategy of getting them to converse about it.
Just thinking, building on Herb's comment, it'd be really nice to do a social network kind of assessment right at the beginning.
Yes.
And then you would expect the fusion to occur most amongst the people most closely linked to the ones in the intervention group. I mean, I don't even know that's ever been studied, and in a way you want that to happen, don't you?
No, you do.
A good intervention is one where you have diffusion effects.
Right, that's a good point. We saw the way we formed even the small group, there were 7 per group, the way we formed them was really logistical, like who's study hall is in third period, right? And I wish we were able to do it with like who are your friends from this larger pool who you'd like to be with.
Yeah.
But we did see some really cool relationship building among students in these small groups who would not necessarily have met or saw each other out, but they at least had developed an additional type of network through how we made the groups.
Well, that makes me think you could do like almost like a contact. So you identify the groups, social groups, and then you deliberately have them cross over. Might be a quick way to build social support and connection.
It would be great. I tell you though, I work really hard with school leaders to make my groups as unobtrusive as possible. So like one principal called me an equal opportunity offender, where the groups rotate through the day. So so if we don't have a study hall that's common, it's hard to pull kids during the school day, right?
Absolutely.
So I'm really at the whim of what a school when they would like me to work with their children. So the equal opportunity offender route is I'll be in first period 1 week, second period the next week, third period. So I don't have much control, unfortunately, of like who's in a group at a single time as I would like to.
Let me preface this comment/question by congratulating you on doing any work in schools. That's very difficult. And doing intervention work in schools is very challenging. You need lots of that. It's really hard work. So, as I understand it, the intervention is directly with the students. So I walked in a few minutes late. Okay. So they're not blinded to whether they're intervention or control, right?
Right. So we do the baseline assessment, and then after they complete their baseline assessments of mental health, then they're randomized.
Right. Yeah. I guess, and I do lots of self-report work as well. I guess there's quite a there's a significant risk of bias in terms of self-reports in an intervention like this.
Right.
So I'm wondering, have you already, or have you considered getting any sort of more sort of objective kind of proxy measures, like any sort of cortisol or maybe accelerometers measuring sleep quality, or is there anything like that you considered alongside the self-report?
Yeah, great question. So where we've been broadening our ratings to are informant reports. So teacher and parent reports also of mental health. Although they're not blind either, which is tough. But I'm also the mercy of my school partners allowed me to take cortisol samples, and they've been kind of nervous about anything beyond the mental health that they're using.
Like hair samples even? Like that could be a way to go. It's a little less intrusive than like saliva and obviously blood. But that's why they the accelerometers, respiratory accelerometers.
Very subtle.
That's a great idea.
Yeah.
It's a very good. Appreciate that. So where we are kind of now, besides providing this tier 2 support for students that have room for growth and happiness, is backing it up and saying, what can we do school-wide, class-wide to support all students' mental health? And the tier 2 development was really done at the request of my school partners with, okay, so if the students with the best outcomes have no mental health problems and high happiness, how can we help the students have room for growth? But we know, obviously, that the best way of supporting youth is by getting in there before the chance to develop low well-being, right? So for the past few years, we've been developing school-wide and class-wide supports to increase all students' positive emotions. So some of the work we've been doing with teachers to see what are the positive ecology interventions and work with adults in general might have the most feasibility for being done in a school context that also increase students and also increase teachers' happiness. And what the outcome that's been most salient to educational partners is burnout. This high-level teacher burnout. What can we do to prevent burnout? That's an innovative strategy besides what we're already doing that are stress management approaches. So we've been systematically identifying and testing out what are those things that work with adults in general to increase happiness that might be feasible in a school context. The one that we feel like is most promising is developed by my student, Molly McCullough. She's actually got her PhD in December, so now my colleague, Dr. McCullough, also married to Dr. Headley. And what Molly developed based on her work as a teacher, she came to graduate school after having spent several years as an elementary school teacher and experiencing the burnout herself. She was particularly passionate about applying positive ecology to teachers. So she tested for her thesis and dissertation a 2-week coaching intervention where the school mental health professional serves in the role of the coach and works with first willing teachers and then all teachers after students, or after the teachers, after the early adapters can say, like, this actually had a positive impact and we have more support for doing it school-wide. She tested out the character strengths uses in new ways with teachers and had some pretty cool effects I'll show you in a second. So what the intervention consists of is 4 meetings with a teacher. The first 2 happen pretty close in time, and then 1 week follow-up and 1 week follow-up. And the first meeting, the school psychologist or coach, if you will, just orients a teacher to the idea of character strengths. They walk them through the character strengths survey available on the BIA character website, and the teacher identifies their signature strengths, if you will. And then they pick the first one to do in new ways in the classroom. And then they track not only their own well-being, but also their feelings of when they use their character strengths in the classroom. And they meet back with the coach 1 week later and share their successes, if they weren't able to enact how to use their strengths in new ways, problem solve any barriers, and then pick a second of their top strengths to use in new ways in the classroom. And their final meeting is with the coach to figure out a plan for sustainability. But honestly, by this final meeting, the teachers have usually got it on their own. Like they get the formula of taking the time to think through how to planfully use their strengths in new ways in the classroom. And what we've seen also is that teachers by this point have figured out what other teachers are going through this program and developing their own PLCs or professional learning communities to think of ways to use their strengths in new ways. So this is just some single case design data. I picked just 4 teachers who went through the intervention the first time. This is baseline and then during the intervention period and then a 1-month follow-up period. And they were rating their sense of well-being on a daily basis. We used the Beeper system. We actually texted the teachers who then quickly went online and used a Qualtrics survey to rate their own life satisfaction and affect, and then we turned it into an SME variable. And what we saw were during the intervention period, there's some dips where teachers were evaluated, for instance, that day, or when they were ill. But what we saw was a trend for increases in well-being that sustained over time, even after we removed ourselves as the interventionists. And when we look across the teachers, what we saw from pre to post to even sustained follow-up were increases in subjects' work satisfaction, we looked at flourishing, and then decreases in stress and decreases in burnout. We don't have a control group, which is our pilot data to see was this intervention even feasible in the schools. But we tried to do single case design to allow them to use their own cells really as their control group. Okay. So after we worked with the teachers to get them oriented to what are character strengths and this process of using them in new ways, then we suggested ways that they could take these positive ecology activities and use them in their classroom, if you will. So we shared with them activities that they could incorporate in their daily teaching that would serve the function of increasing students' positive emotions or quite possibly strengthening relationships. So we chatted with the teachers about how to do things like help students keep gratitude journals, you do acts of kindness, both spotting their own but also planning and reporting back, and then writing activities where the students would visualize their best possible self in the future or a time that they were at their best in the past. Some teachers wanted a whole class-wide curriculum, so what we did was take the WellBeing Promotion program that we've done in small groups and expand it into a class-wide format. But also, rather than having access to the parents, we incorporated some class-wide components to strengthen the classroom relationships. So in addition to the students' activities, at the very beginning of each week, we asked the teachers to share what were the positive relationship building things they saw with their kids that week. So we said, take a few minutes to brag, if you will. What are the kind acts that you saw your students doing? What strengths were they demonstrating? And then we asked the students to do the same thing about each other and their teachers. So they had this opportunity to verbally acknowledge things that were going well in the classroom. And then we jumped into some of the more traditional positive activities each week. As we've done this, we've mostly been in the elementary school grades, whereas the WellBeing Program was middle and high school. So we've had to work through issues of developmental fit, but also even measurement. You know, how do we assess a subjective construct in kids that are K through 3 and are not able to fill out some report measures as well as other students? So we've been playing with measurement recently. This is the version that we actually were able to individually administer to even kindergartners this year, where we took Scott Huebner's brief multi-dimensional life satisfaction scale and then adapted it to be much more visual and asked kids, not a scale of 1 to 7, but on a 1 to 5, from terrible, delighted to terrible, please circle your current level of happiness in these areas. This is the version that has worked best with our kids so far. We've gone through many iterations. The only thing I'm not showing you is we also shade the lines to make it less likely they'll skip around. And then again, individually administer it. Yes?
Were these individually administered? Or
this version we did class-wide. So we have about...
That's real demanding.
So we had about 20 kids in the class, and then we had the teacher and then 2 of our research staff. So, and then we put this up on the projector in the front of the class. So the one person will be up front and the other 2 are walking around and assisting. So that did work, but what we find works better is the individual administration. So when we do this for a research study, we do it individually. But we did a class-wide and a school-wide test just last year.
When we worked with this, with our self-concept instrument, we tried that, and what worked better was what we call a double binary question. So
yes.
We asked true, false, and then if they said true, very true or a little true, false, very false, or a little false. And so they answered it twice, and that gave us better reliability than the pictorial ones. And it also had a self-correction because you asked the same question twice, and if the kids said, "Oh, that isn't what I meant."
Right.
So, you know, and we were able to take that down to 4 years old.
Wow.
With individual administration oral.
Okay.
Yeah.
That's great.
Mm-hmm.
Yeah, with most of my work being with teenagers over the years, it has been a learning curve to work with the younger kids. But that's another great strategy. Thank you. The other part of our learning curve is just taking activities that were made for adults and figuring out, how to sustain little kids' attention. So we've been taking the positive activities from the adult literature, tested on teenagers, worked just fine, but littler kids, they learn through reading, through playing, many more modifications. So we've been scouring the literature for different children's literature books that work well to teach the same concepts. So we introduce these things like gratitude and kindness and signature strengths through the books that are the most closely aligned, and then at different activities and coloring sheets that still get at the same goal of increasing gratitude in this case, but with developmentally appropriate strategies as opposed to simply keeping a gratitude journal, which isn't going to work for a little kid. Kindness, we found a lot of great YouTube videos that are Sesame Street developed that say the exact points that we're looking for. And then when we have our class activities like gratitude visits or you at your best, we've been allowing kids the options of you write, we write, or we draw. What would you prefer? So these are some draws. We do best possible self in the future. With our adolescents, they've always narrated a story. With the little kids, we say, pick any point in the future and draw on your best possible self in the future. And then together, what are the strategies that you would like to think through to help you attain your best possible self in the future? So where we've been going with this is how to incorporate these different positive activities in a multi-tiered system of support. And what we know is that the presence of internalizing actionable problems bodes poorly for ultimate academic success. But we also have some data to show that wellness matters above and beyond problems. So I've been working with our local schools to think about how do you prioritize what you offer to all students. And what we've been doing is incorporating the positive ecology strategies in a comprehensive multi-tiered system of support where it still includes things that help to reduce externalizing problems like positive behavior and student supports, we still have quite the value and role for classic social emotional learning. It's meant to down-regulate emotional distress. But we also want to invoke positive emotions and upregulate positive emotions through this blending of more traditional SEL approaches with positive activities, and to tend to teacher wellness and screen on both dimensions. Skip through this. So one thing I've been working on that's coming out is an edited book through Oxford that'll be out next year that I'm working on with Beth Dahl and Phil Lazarus. That is a series of edited chapters on what are those universal supports that address both factors in a dual factor model of mental health. And in our first chapter, we introduce this picture, if you will, that purports that, when we look at students' mental health, it's not just the absence or the presence of problems that causes issues, but instead, we want to look at the students' level pathology and their well-being so we can shoot for this complete mental health, that quadrant, if you will. So the chapters cover things from bullying to social emotional learning programs to healthy eating, and review the links on that target in relation to both psychopathology and wellness, and offer evidence-based tier 1 and tier 2 strategies for both of those targets. So, wanted to end with this picture of this total model of mental health, and again summarize that where I see positive ecology fitting in are on these strategies that increase positive emotions, which are as important as those traditional educational practices that prevent and ameliorate suffering. So all of these things have a place. I wish it was just one would be the magic answer for schools to focus on. But all of these initiatives have a place when we define mental health comprehensively. Plenty of time for questions. Happy to chat more. Thank you.
The symptomatically contemporary.
Yes.
I wonder if you could tell me a little bit more about the kids in that group and how they end up in that group and not the trouble group. What is it about their environment or their personality or whatever that leads them there and not there?
So they're distinguished by really good social relationships. So I don't have the longitudinal data yet to say what leads them there, but their primary features are that presence of positive social relationships with their classmates, with at home, with their teachers, and what they look like kind of profile-wise, they're definitely more likely to have externalizing problems and internalizing problems. So when we've looked to see what are the types of symptoms that they're presenting with, they're more likely to be bothering others and not themselves, if you will. So they come up elevated on teacher-reported externalizing problems, but not, there are still some kids that have elevated levels of anxiety, but more externalizing than internalizing symptoms. We see a lot of overlap between internalizing symptoms and low SWB, if you will, which makes sense.
One of the approaches that we're looking at with measuring well-being is taking diagnostic DSM characteristics, and instead of saying that well-being is the absence of those, to flip them around.
Great.
Right. Come up, and so we've got 10 standard diagnostic categories that we're measuring the positive end rather than the negative end. And
Great.
arguing that that's our measure of well-being, along with some other things as well.
That's great.
Wondering how that fits in with your model, because it sort of cuts across your two-factor sort of notion, because we're arguing that life satisfaction isn't enough, that it has to be a multidimensional, but it's also picking up on the diagnostic categories if you're looking at the other one. Interesting.
It's a great question. My colleague Mike Furlong at University of California, Santa Barbara, has developed the SCHS, Students' Emotional Health Scale, that looks at the building blocks of SIB, if you will. So just a series of 24 factors, maybe it's 12 factors, like engaged living, so it looks at students' levels of internal building blocks of wellness and their external supports that would predict wellness. And he's done some really cool studies that if you look at these building blocks of well-being in relation to life satisfaction at the latent level, what is the overlap? And his studies have shown it's like higher than 0.9, the latent level, that when you have this ultimate outcome of life satisfaction, if you will, but all of these other things that should predict it, it's pretty high. But it's a great question. I've been wanting to look at that myself and look at like Peggy Kern's measure of PERMA. I'm curious how that overlaps or correlates at the latent level with life satisfaction, which is so much more simpler, but also not as sophisticated. It doesn't allow you to drill down into what is the area that's behind someone's well-being.
The problem with PERMA is the scales are so highly correlated that you really don't have any differentiation. Yeah. But that's not a problem because you're using fairly global measures anyhow, and so I guess that you're not that concerned about the differentiation of factors within a PERMA kind of model.
No, but it's the same, right? But what I am interested in is it too global, right? So if you're just looking at somebody's life satisfaction or SWB, does that give you enough data to know who are the kids that are most in need of supports? So what we've been using it as is a screening tool. And then once a student is screened as having any room for growth and well-being, then we've been using longer, more complex measures of life satisfaction in different domains, plus clinical interviewing to know what is the thing that's behind this child's relatively low wellness.
And here's a simple question that we never answer with our measures, which is the screening useful? So, like, you can imagine a condition where you identify kids and you give them intervention, other kids don't. And on the other side, you just randomly assign to the intervention. You don't use the measure at all as guidance. The question is, how much does using this measure improve outcomes? And that simple psychological question is just not answered in psychology. Like, are our measures useful for intervention? Every time we do a measure, we say this is useful for intervention.
Yeah, but is it? That's a great point. It's a great point.
Yeah.
I've done more work on screening for mental health problems than I have wellness, and I'm also troubled with the lack of like repeatability of kids' self-reports of their current feelings, right? Yeah. So when we've screened for anxiety and depression to figure out who to put for tier 2 supports for kids with mental health problems, for the kids who screen positive, we assess them the same measures 1 week later, and always it's a reliable 15% of kids who are like, oh, I'm fine now, that was a bad week, right? So it's a great question.
Yeah, I mean, I think it would be, but it's just simply we have to demonstrate it. And then that would start to define purpose.
This is the beauty of having a cut point. If you put a hard cut point, you can compare kids on either side and see if there's a difference later on.
That's true. You could just give everybody the intervention.
The very fact of having a cut point allows you to look at, it's a natural experiment.
Yeah.
I'll say with our class-wide work so far, what we have seen is that positive outcomes are pretty reserved for kids that start with low wellness. So when we've taken our work and applied it class-wide, we see a moderator effect where the kids who start low are the kids who seem to have a positive impact of the intervention. But I also think we have some massive ceiling effects. We have a lot of kids, fortunately, with little kids, a lot of them feel really good. So we haven't yet seen, so when we fail to see increases in wellness, and it's a ceiling effect of like, started high, still high. So we're trying to gather data to follow them longitudinally to see when there's more variability, do we see a preventative nature of early interventions to support all kids' wellness, that you may not see that positive impact till down the road.
What about ethnicity? Have you seen a difference in levels of wellness for ethnicity and also in relation to the interventions? Are there, like for example, Indigenous groups or, have you looked at any of those sorts of sample characteristics?
Yeah, great question. So my work has been exclusively in Florida schools. And the nice part of that is that that's fine.
I took an education and now what's up.
So I don't have a sample of an indigenous group, for instance. What we do have is really rich diversity in terms of about half of my sample is non-white, if you will. Yeah. So we have kids that are from who are Hispanic, Latino backgrounds, also African American, Indian students. And we haven't seen a moderator effect of student ethnicity or of SES level, kids who at the crude level qualify for free reduced lunch or not. We haven't seen that dictate outcomes any differently across students.
Interesting.
But we haven't also systematically applied it to a unique group of children.
Sure.
So, good question.
Have you seen that ethnicity affects parents, like the parent engagement?
So, good question. So the study that I shared, the outcomes of the most recent RCT, the WellBeing Program, we had about 70% of parents engage with the intervention, like come to the first meeting to even learn about it.
Yeah.
And then 100%, I'm assuming, received the materials that were in a written format throughout the time. I don't believe we looked to see who the 30% were who didn't come originally, for instance. So I'd have to look into that.
It's very high, this must be good, these are good schools? I mean, like, wealthy schools?
So the only time I've had it that high is when a condition of being part of the project was that you agreed to come and learn about it. So even when they agreed, I still only got 70%. And that was when we offered the one session. During the day, in the evening, we'll come to you personally, and we still just got 70%. But one of my schools, that's for a different project, it's in a lower, it's a school that's put into a magnet area, so the students don't live in the community, so they go into the school as a different community to receive a certain educational program. One thing that we were recommended to do there that's actually well received was turn our information into a YouTube video that would then be sent out by a link to the parents, and they could watch it from their houses. So we've had to be more creative in some schools.
Did they watch the link? Did you check?
I don't have the data on if they watched it. It's a good question. I have like anecdotal evidence from parents emailing me thanking me for it, but I don't know what % actually watched it. But it was more than the 0 who came to our parent seminar. So when we had 0 parents show up, of 60 kids served, we knew something else had to happen. But the school was 50 minutes from where most parents lived, and parents were busy, they worked multiple jobs. And, yeah. Parent engagement work is hard work, right, to get parents in. Yeah.
Well, thank you very much for the overview.